Miles. I'm the Health Services Manager for the Dartmouth General Peri-Op Department, and this is our new OR7 in our Peri-Op suite.
Hi, I'm Dr. Natalie Cheng. I'm the medical site lead for Dartmouth General. I just want to take this opportunity to thank donors for this amazing gift. As you're going to see in the upcoming tour, these new ORs are offering such an opportunity in terms of improved patient comfort, improved efficiency through use of technology and use of ergonomically improved setups. We have so many opportunities for the little improvements that add up to make a huge difference. So things like having equipment in the room, having technology that's integrated, it's all going to equate in more efficient and effective care that's going to get better care to our patients. It's going to get better care to more patients as we have efficiencies that reduce wait times, get more patients through getting the right kind of care they need. So this is a huge, fantastic opportunity which is due to you, so thank you. In terms of the transition over, it's going to be happening in phases. So next week, we're actually going to be starting with the EMT rooms. That's the first group that we're bringing over from the VG. And these rooms, each room is to some extent specialized towards the type of surgery that are going to be happening in that room. So this is going to be the EMT room. We also have a couple of rooms that are going to be dedicated towards arthroplasty and such. Now each room has a bit of a purpose to it. And so we're going to be having more orthopedic coming in the February to March next year. We're gradually rolling out general surgery, urology over the next 12 months after that to decant the Victoria General.
My name is Kevin Bennett. I'm one of the anesthesiologists here at the Dartmouth General Hospital. I've been fortunate enough to be here long enough to be involved in some of the planning of this new build, and now enjoying to see what it looks like when we're done. This is typical of one of the operating rooms, one of the new operating rooms here at the facility. These were all built with the ability to do any specialty surgery-wise in them, but this one is going to be set up for doing ear, nose, and throat surgery. It is one of the specialties that uses lasers, so we have actually, unfortunately, less natural lighting and smaller windows than some of the other operating rooms, but again, more for patient safety. This new operating room also has one of our newest anesthetic machines that both gives a safer anesthetic, and they are much tighter tolerances than our older machines, so we use much less medication. And those medications we like to use as little as possible, both from the patient standpoint, and they do have some effects on the atmosphere, and everyone's concerned about our environmental impact going forward. Speaking as an anesthesiologist, I would consider this corner of the operating room the most important, because this is where I look after the patients who are coming in for their surgeries. As well as the anesthetic delivery system, I also have the computerized record keeping, so I can check on any past history of the patient and their past experiences with any anesthetics here in the district. There's also some specialized anesthetic equipment associated with the integrated video system that we have here that enables me to do a safer job of looking after airways for people getting general anesthetics. I'd like to put a special thanks out to our donors. Quite a bit of the equipment in this room has been supplied and funded by your generous gifts, and we use it every day, and we very much appreciate the ability that we have with this newer equipment. The fact that it's integrated into the rooms actually means it's likely to last a little longer than some of our portable equipment that we've used in the past, and will enable us to, again, enjoy your generosity, hopefully for a longer period of time. But it's all part of trying to make the environment comfortable, and it's not because we want to be comfortable, it's because patients do better when they're less scared. And that units are lower when you control the temperature. So it's all working towards the same goal. It's not just one uncomfortable one patient. And we're talking about, what have we learned about infection risk. And yeah, part of the reason we like to have these booms for all our controls is we can clean underneath. There's no, I won't comment on anyone's corners in their garage. You have the ability to totally clean the floors under everything. It makes a difference. It's easier and faster to clean rooms in between cases. It's a more efficient DORs can be. And it's a valuable resource for the province. And we want to do everything we can to make the time be as efficient as possible. So it's great for the patient, but it's also great for the greater system that we're trying to support.
I found one really interesting part was they used some improved technology capacity. So there is a camera that's built into the light, which is projected onto the screen. So we do teach a lot of students, residents. So we have nurses, and so we have all these students who in the past would have been sort of trying to look over the shoulder of the surgeon as they're getting into the small details. Now the learners can have the same view as the surgeon and really see what's going on, and it seems a much improved learning experience for our members.
Very true. And not just the women. So, by the same token, if you have a surgeon on each side of the table, and it's the belly surgery or something, they both have their hands sort of in here, the ability of the nurse is standing over there to see what the surgeon is doing, to anticipate and lay the hand on the thing they're going to do next, realizing they can see what they're doing. So, even without learners, it also increases safety and ease and efficiency of the work being adopted. One of those, it helps everyone, also it's fantastic.
The natural lighting.
So the natural lighting was not the choice of mine, but I can't believe it's probably my most favorite thing about the afternoon. And it's a little deceptive here because this room has by far the smallest window, so it's the whole length of the wall. And you wouldn't believe how pleasant it is to have a sense of what's happening as the day is passing when you're in the operating room. And it also, although these rooms are much bigger than our old operating rooms, and a lot of reasons for that, they take more space in our rooms, but they still feel small enough. So you open the blinds and suddenly it just feels so spacious. There's no sense of being packed in or crowded in a little room.
I can imagine if you were a bit apprehensive too to see the sky.
Yes.
Like, rather than being
A
a
sense of comfort.
with four walls, it's like, okay, that's the sky and I know that. Just to sort of calm yourself down.
So
And what about the green light?
yeah, so the green light is for more for the laparoscopic surgery. It hasn't, some specialties find that less distracting than the other very bright light, but we don't use it too much. It's part of the endoscopic mode, but in reality, these pockets that sit around the side are as useful, right? So we turn off the greens and just sort of have these lights along the edge. And that way, the nurses in anesthesia who are not contributing directly to the surgery, not scrubbed, they have more light in the areas where we're walking and working. But light directly over the table is minimized to allow that to be, keyhole laparoscopic surgery.
More space, the mobility of our units, space to put our monitoring. You remember how the old place was. I barely remember. A real massive difference.
Awesome.
There you go.
Hard to imagine going back to something like that now.
Yeah, it's hard to quantify, but I can't believe that it doesn't help, mental and physical well-being and outcomes.
For staff and patients.
Exactly. That's what I meant. Yeah. True.